Welcome back to another episode. As usual, everything we discuss today is for educational purposes only, and it cannot be and should not be a substitution for professional medical advice by your personal healthcare provider. Having said that, I'm Dr. Kwaz, and today we're going to be discussing how to reconstitute peptides, how to store those peptides, and more importantly, how to inject those peptides. So the first step is we're going to reconstitute the peptide solution. Items that are going to be required for that are your rubbing alcohol. 91% is preferred. You can also use alcohol swabs that come individually packaged, or you can grab a cotton ball and just pick some 91% up alcohol from any of your local CVS or Walgreens. Next, you're going to need bacteriostatic water. You can use sterile water, but bacteriostatic water will allow the peptide to stay good for a lot longer than if you use sterile water. Next, you're going to need to peptide yourself. Now, why do we even need to reconstitute a peptide? Well, the reason is because when we receive the peptide, it comes in a powdered form in this vial, and we need to put fluid to it, preferably bacteriostatic water, to reconstitute it to a solution that can be injected. Lastly, you're going to need your insulin syringe. Typical question is, well, what kind of syringe or needle do I need? A typical needle that you would use would be a 28 gauge, 1 mil, half-inch needle. That will accomplish everything you need. First thing you do, you take your peptide. There'll be a rubber cap on it, usually different colored. You'll simply pop that off. You'll take your rubbing alcohol. You'll douse your cotton ball with it, or you'll open your individually packaged alcohol swab. The reason we're doing this is because the only real risk factor when injecting peptides is the risk of infection. So you want to reduce that risk, and you do that by disinfecting it with 91% alcohol. Just rub the top and the rubber stop, rub the top. Next, you take your insulin needle. There's going to be a plastic lid on the back. You pop that off. You pull the needle forward and back to make sure that there's no air leaks and make sure that it's fully usable. Then you pop off your top. What you're going to do is you're going to pull some of your bacteriostatic water out. Now the next question might be, well, how much fluid do I add to the peptide solution? Well, there's a simple way to do this without having to sit down and do all the different peptide calculators. A good rule of thumb, and one that I would like to use and advise people to use, is if the solution, or if the peptide says that it's a 5 milligram dose, you'll use half that amount of fluid. So if it's a 5 milligram dose, you'll use 2.5 milliliters of fluid. If it was a 2 milligram dose, for instance, mod GFR 1 through 29 often comes in 2 milligram dose vials. Well, half that fluid solution would be 1 milliliter of bacteriostatic water. So it keeps it pretty simple. Always use half the amount. Now, with that, what is that going to give me as a dosage? So it's pretty simple. On this insulin syringe, you have units, and every 10 international units is marked with a number. So it'll go 10, 20, 30, 40, 50, all the way up to 100 international units. If you use the method that I just described to you, which is half the fluid solution of the milligram dose, so if it's 5 milligrams, it'd be 2.5 milliliters of fluid, then every 5 international units is 100 micrograms. I can sit here and explain the math to you, but there's really no point. Just take my word for it. All right, so our next topic is, where do we store these peptides now? We know how to reconstitute them, we know how to dose them, we know how often. Where can I store them to keep them in the best possible condition? Well, much like most medical solutions, as long as they're kept in a cool, dry place, they'll be fine. If you have the peptide still in its powder form, feel free to put it in the freezer and it can last a lot longer that way. If you already have it into a fluid solution, my coaching to you would be to store it in your fridge. That's probably the best place for it. It's cool, it's dry, it's dark, and you don't have to worry about it falling on the ground or breaking. Now, before we move on, Why do we use bacteriostatic water instead of sterile water? Well, bacteriostatic water will actually keep the solution more viable, and you'll be able to use it for a longer period of time. I believe upwards to 30 days. If you reconstituted your peptide with just sterile water, it might only last for, say, 7 to 10 days. All right, our last topic for the day is, how do we inject it? We know how to store it. We know how to reconstitute it. We know our dose. How do we inject it? Where do we inject it? Why is it different than any other type of injection? Well, as you can probably already figure out, we're not doing your typical intramuscular injection with this. This is going to be a sub-Q injection. That's why we're using 1/2 inch, 1 mil, 28 gauge insulin needles. This is going to go into the subcutaneous fat. Where, you ask? That's a great question. As long as you put it around 6 to 8 inches from your umbilicus meaning belly button, you have the best chance for it working. So let's take you through that. Step 1, you have your reconstituted solution that is a fluid. You take your brand new insulin needle, make sure you have it handy. You pop off the back. Once again, you check it to make sure that it's fully functional and it's not have any defects with it whatsoever. You take your rubbing alcohol. You once again either take your swab or your cotton ball, put it with 90% or 1% alcohol, and you rub the top just to disinfect. Once again, the biggest risk here is the risk for infection. We're trying to reduce that right now with this 91% alcohol. Rub the top. Now, you pop your lid off. I like to inject a little bit of air just to be able to replace the fluid solution that I'm taking out. Slowly put it in, push your solution in, and then you draw back whatever it is the recommended dosage is. If you're going by what we talked about last day, that would be 300 to 400 micrograms, and if you're using the method I'm telling you, that would be around 20 international units. Now, with your non-dominant hand, you're going to take within 6 to 8 inches of your umbilicus, you're going to pinch about an inch apart, and you're going to grab fat and skin with your index and your thumb. Now with your dominant hand, you take your alcohol swab. You rub the area to reduce the risk of infection. You're going to pinch it. Now with your index, middle finger, pinch it. You inject your needle. And then with your index finger, you just push the needle in. Just like that, you're done the injection.